Hi, my name is Dr. Anthony Nguyen, and I'm in Mobile, Alabama at the VIP Care Skyline practice. One of my patients who basically was struggling with his diabetes and had it for at least a decade or more. And as I was looking through his records, it seemed like either A, the doctors weren't listening, or they just were neglecting that his diabetes was never controlled. And it actually shocked me that as I looked back in his records, his A1C was always basically double digits, 10% or higher, which implies that his blood sugar was probably 3 or 4 times where it should be. But yet, they never made any changes. They just kind of kept the same plan, which I found odd. And so when he came to me, we sort of established first was what was his understanding of diabetes. And so I always ask patients like, when I say diabetes, what does it mean to you? And 90+% of the time, the patients have no clue, right? And so to me, that's shocking because this is a disease that they have to live with, 95% of the time, and yet they have no idea what it is. And so we always start first with education, and I always try to let them understand that process, because I think the more they understand, I think the why is more important than the actual plan itself. So when he first came, his A1C was about 12%, again, which is extremely high. Blood sugar is probably in the 300s averaging. And then within 3 months, that number went down to 8%, which is just remarkable in itself. And then more recently, he completed a 5K, which he'd never done before. He completely changed his diet. And again, just understanding the disease process is what helped him to realize what he was doing that was actually not helping. And then on our side of things, I think the medication side is like the easiest part. It's really what the patient does, but he has to know what to do and why to do it. And I think that's what's really changed, his outcomes.